Hello friends, today we are going to talk about the anatomy related to the scapular region. Now again, as a physiotherapist, we see many patients who have shoulder pathology. So you may get a patient with the frozen shoulder of patient who had got fracture around the shoulder, or else even stroke patient where they develop shoulder pathology, shoulder dislocation, shoulder subluxation, rotator cuff tear, subacromial bursitis, supraspinatus tendinitis. So we have to deal with all these cases. Okay, and we'll get plenty of patients in our career. So for that, to understand the anatomy behind that, what is all the structure, how they are formed, we need to understand the basic anatomy of them. So right now we are going to talk about scapular region. So the first thing in scapular region, we'll be talking about the muscles of your scapular area, which is mainly five muscles. So we'll see each of them one by one. So we get in scapular region muscles, we get supraspinatus, infraspinatus, subscapularis, teres major and teres minor. These are the five main muscles which are present around your scapular area, or they are originated from the scapula and inserted on the humerus, and they play a major role, a very important role for your upper limb function. So these are the five muscles. ये पांच muscles है जो बहुत ही जरूरी है आपके upper limb functions के लिए. So they are like, the first is supraspinatus. In scapula bone, when we were discussing about that, we had discussed about the supraspinous fossa, which is above the spine of the scapula. So the supraspinous fossa is giving origin to supraspinatus muscle. So up medial two-third of the supraspinous fossa of scapula will be giving origin to the supraspinatus muscle. We can see in the diagram the green color is representing supraspinatus muscle. The insertion is on the upper impression on greater tubercle of the humerus. In humerus, we have a greater tubercle, a small structure which is present in the upper part of the humerus. So in that greater tubercle, you have three impression: upper, middle, and lower. Among these upper impression, जो greater tubercle जो आपकी humerus के ऊपर होता है, उसके अंदर तीन impression होता है. उसके if you see the bone, it has three parts. In that greater tubercle, that there are three parts. उसमें से जो upper impression है, which is giving insertion to the supraspinatus muscle. Now it is supplied by suprascapular nerve, and the action of the supraspinatus muscle. It's so along with the other scapular muscle, it steadies your head of the humerus. So whenever you are doing any kind of shoulder movement, whether abduction, reduction, or flexion, or when you are lifting some heavy weight, it fixes your head of the humerus, so it won't come out of the glenoid cavity. So that's why this scapular muscle is providing a stability to your head of the humerus. The second thing, ये आपका एक अबडक्टर की तरह काम करता है, शोल्डर का अबडक्टर जो इनिशियल रेंज में काम करेगा 0 to 15 डिग्री में, अप टू 90 डिग्री डेल्टॉइड काम करेगा, बट इनिशियल रेंज इज डन बाय supraspinatus. But yet there is a controversy. Early it was believed that कि हाँ शुरुआत के abduction range के लिए काम करता, but the new research, they come up with the new finding, and they are saying that along with the deltoid, this supraspinatus, it helps you not only in the initiation of the abduction, but to complete a whole abduction range. Throughout the range, the supraspinatus will be working. So in that way, it is playing a major role in your shoulder abduction along with deltoid. तो ये आपका ओरिजिन होता है सुप्रास्पाइनस फोसा से, जो स्कैपुला का अपर पार्ट है स्पाइन के ऊपर, और इंसर्ट होता है ग्रेटर ट्यूबरकल में जो ह्यूमरस का है पार्ट, और जिसके अपर इंप्रेशन ऑफ द ग्रेटर ट्यूबरकल में इंसर्ट होगा. ये सप्लाइड होता है सुप्रास्कैपुलर नर्व से, और इसकी एक्शन होती है आपके हेड ऑफ द ह्यूमरस को स्टेबल करके रखने का और अबडक्शन में हेल्प करने का, abduction of the shoulder में help करने का. A second muscle what we are going to talk about is your infraspinatus. So below the spine of the scapula, you get the infraspinous fossa. So from that infraspinous fossa, the medial two-third of the infraspinous fossa will be giving origin to the infraspinatus muscle. Again, in the diagram, we can see it with the green color. The insertion is the middle impression on the greater tubercle of the humerus. So जो आपका three tubercle होता है head of the humerus में, greater tubercle में, इसमें second impression, जो middle impression is giving place to insert your infraspinatus muscle. Now this is also supplied by suprascapular nerve, जिसकी root value है C5 C6, same like The previous muscle, supraspinatus, is also supplied by suprascapular. Now, action, it is helping you for the lateral rotation of the arm. So, arm lateral rotation, and it also steadies your humeral head. So, humeral head को fix करने के लिए भी ये काम करता है. So that is about the infraspinatus muscle. Infraspinatus again, it is originated from, कहाँ से वो origin होता है? Infraspinous fossa में से, जो scapula का spine के नीचे का part है, insert होता है आपके greater tubercle के middle impression में. नव सप्लाई होती है इसकी सुप्रास्कैपुलर नव C5 C6 उसकी नव रूट है, और एक्शन है इसका लेटरल रोटेशन ऑफ द आर्म, जो आर्म को लेटरली रोटेट करेगा, या तो ऐसे या तो फिर ऐसे. ये पूरा का पूरा आर्म व्हेन इट इज रोटेटिंग लेटरली ऐसे, या फिर इवन इन दिस वे, इट इज हेल्पिंग यू फॉर द लेटरल रोटेशन. और दूसरा आपके हेड ऑफ द ह्यूमरस को स्टेबल करने के लिए भी ये काम करेगा. द नेक्स्ट इज टीरीज माइनर. टीरीज माइनर इज अनदर स्कैपुलर गर्डल मसल, जो ओरिजिन होता है अपर 2/3 of dorsal surface of the lateral border of scapulus. We can see in the diagram, dorsal surface पे posteriorly over the dorsal surface in the upper 2/3 of the lateral border से वो origin होगा. It is inserted into the lowest impression on the greater tubercle of humerus. So lowest impression of the greater tubercle, upper में supraspinatus, middle impression में infraspinatus, and lowest impression में teres minor will be inserted. Now supply is done, supplied by axillary nerve, जिसका रूट वैल्यू है C5 C6. तो एक्सिलरी नर्व में दो मसल सप्लाइड होता है, एक तो डेल्टॉइड है, दूसरा है एक्सिलरी नर्व से सप्लाई होने वाला टीरीज माइनर. The action of this teres minor is your lateral rotator of the arm. This is helping you for the lateral rotation. It studies the head of the humerus while shoulder movement. इसमें भी ये help करता है. तो mainly it is helping you for the lateral rotation. So the sit muscle, they are also called a sit muscle, SIT, where S for supraspinatus, I for infraspinatus, and T for teres minor. ये तीनों muscles are inserted over the greater tubercle. उसके तीन impression है, upper, middle, and lower. Upper is inserting supraspinatus, middle is inserting infraspinatus, and lower is inserting teres minor. अपर में सुप्रा इंसर्ट होता है, मिडल इंप्रेशन में इंफ्रास्पाइनेटस इंसर्ट होता है, और लोवेस्ट में teres minor इंसर्ट होता है. The next, after teres minor, the another important muscle from the scapular girdle is your subscapularis. So subscapularis, जैसे स्कैपुला में सबस्कैपुलर फोसा है, वहीं से वो ओरिजिन होता है. अगेन उसमें से मीडियल 2/3 ऑफ द पार्ट ऑफ द सबस्कैपुलर फोसा विल बी गिविंग ओरिजिन टू सबस्कैपुलारिस मसल. आपके सबस्कैपुलारिस मसल को वहां से ओरिजिन करेगा. इंसर्शन करता है लेसर ट्यूबरकल ऑफ द ह्यूमरस में, ह्यूमरस के लेसर ट्यूबरकल में इंसर्ट करेगा. नर्व सप्लाई इसकी है अपर एंड लोअर सबस्कैपुलर नर्व, जिसकी रूट वैल्यू है C5 एंड C6, upper and lower subscapular nerve. And action is, it is helping you for the medial rotation. So the previous muscle they were doing lateral rotation, this is going to do medial rotation, and it is going to help you for the adduction of the arm, to bring the arm back to the original position towards the midline. This will be working, that is done by subscapularis muscle. The subscapularis सबस्कैपुलर फोसा से ओरिजिन होगा, इंसर्शन होगा लेसर ट्यूबरकल में, आगे के एसिट मसल इंसर्टिंग ऑन ग्रेटर ट्यूबरकल. ये वाला अकेला मसल जो है वो लेसर ट्यूबरकल पे इंसर्ट होता है, और इसके एक्शन है मिडल रोटेशन ऑफ द आर्म एंड अडक्शन ऑफ द आर्म. The last muscle from the scapular region is teres major. So ये origin होता है lower 1/3 of the dorsal surface of the lateral border of the scapula and inferior angle of the scapula. वहाँ से origin होगा. We can see in the diagram कि dorsal surface के lateral border पे से और lower angle में से या inferior angle में से वो origin हो रहा है. Inserted over the bicipital groove या फिर मतलब in the medial lip of the bicipital groove और intertubercular sulcus का medial lip. Lateral lip is giving origin or insertion to pectoralis major, and between that two major, latissimus dorsi is inserted. That's why that part is called as lady between two major. So ये teres major is inserted over the medial lip of the bicipital groove, जो यहाँ का structure है आपका humerus का upper part में, यहाँ पे ये present होता है. Between greater and lesser tubercle के बीच में से groove pass होता है, which is giving insertion to the medial lip of that groove is giving insertion to teres major. Now supply, it's supplied by lower subscapular nerve, C5 C6 उसका nerve root है. Action है medial rotation of the arm and adduction of the arm. So we saw that supraspinatus helping you for abduction, infraspinatus and teres minor is working for lateral rotation and studies the scapula, while subscapularis and teres major is helping for the medial rotation of the arm and adduction of the arm. So after that, the another important part from this area is your musculotendinous curve of shoulder joint or else rotator cuff. Now this is a very important thing in our whole career. Definitely will come across number of cases who are suffering with the rotator cuff tear where or else rotator cuff injury या tendinitis in the rotator cuff muscles where the inflammation is there. तो ये बहुत ही जरूरी वाला point है. Now that's why it is very important for us to understand how your rotator cuff is providing the stability to your shoulder joint. So rotator cuff, what is rotator cuff or what is musculotendinous curve of the shoulder joint? So it's a fibrous sheath formed by four flattened tendons. Which are those tendons? Those tendons they are arising from the scapula. मतलब कि आपके supraspinatus, infraspinatus, teres minor, and subscapularis. All these four muscles. Teres major is not a part of rotator cuff, but rest four muscles वहां से जो scapula से origin हो रहे थे और humerus के upper part में आके insert हो रहे थे वो आपके रोटेटर कफ में को बनाने के लिए हेल्प करेंगे. So what they are doing, they are helping you to make a fibrous sheet, and where the tendons are going to get flattened up, then they will merge with the capsule of the shoulder joint, and then they are helping your shoulder joint capsule by strengthening it. Okay, so they strengthen the shoulder joint capsule. Those muscles which are here, all those four muscles, they are originated from the scapula. Scapula से origin हो रहा है. They get inserted into greater tubercle or greater tubercle and lesser tubercle of the humerus. दोनों वहाँ पे मतलब all four muscles are inserted in those area. And subscapularis, supraspinatus, infraspinatus, teres minor. These are the four muscles which is making rotator cuff. Tendons, while crossing the shoulder joint, they will merge with each other. All those tendons will merge with each other. They will blend with the capsule of the shoulder joint, and then they will insert. So again, they are mixing with each other, then they are mixing with the capsule, and then they are inserted at their respective places. Function, it gives strength to the capsule all around except inferiorly. So ये जो होता है muscle, ये चार rotator cuff, anteriorly subscapularis, यहाँ पे supraspinatus, infraspinatus, posteriorly teres minor. इस तरह से पूरी जगह से वो आपके शोल्डर को स्टेबलाइज करता है, शोल्डर को सपोर्ट करता है, होल्ड करके रखता है. And that's why it is very rare to except inferiorly doesn't provide any support, but anterior, superior, posteriorly, everywhere this rotator cuff is providing support. So we can see over here. So this is subscapularis here in this diagram. Then you have supraspinatus, infraspinatus, and teres minor. In that way, this is providing good support to your shoulder joint, except inferiorly. That's why it is very common to have inferior dislocation, because inferiorly there is not any support. Yeah, long head of tricep is present, लेकिन अगर कुछ ज्यादा फोर्स आ गया तो वो भी काम नहीं कर पाएगा. So this is your rotator cuff. Now, another important structure which is present in this area is subacromial bursa. Again, we will find many patients who is suffering with the subacromial bursitis. They have pain while doing overhead activities because the bursa is getting inflamed over here. Now, how this bursa is present? We can see in the diagram the subacromial bursa, which is just present below the acromion process. And here there is a coracoacromial arch. The arch is which is connecting coracoid process and acromion process. So below this arch, you have this bursa. So it's the largest bursa of the body, which is situated below the coracoacromial arch and below the deltoid muscle. This is also called a subdeltoid bursa. Below bursa, you have supraspinatus tendon and greater tubercle of the humerus. So we can see here the supraspinatus tendon is passing beneath the bursa, and you have the insertion of the supraspinatus. It's a greater tubercle. So that is also present below the bursa. So the function, as we know that bursa is working as a shock absorption, or they do the shock absorption function. So here this bursa, it plays a major role in shoulder abduction. How? It protects the supraspinatus tendon against the friction with acromion. So if bursa is not there, and whenever you do overhead abduction, repeatedly this supraspinatus tendon will get friction beneath the acromion process, and that can give rise to damage to the supraspinatus tendon. The other thing will be during overhead abduction, as greater tubercle will pass under the acromion. If bursa is not there, then this transition will be very difficult. So bursa, the subacromial bursa, is providing an easiness in performing abduction, so that easily your greater tubercle will pass under the acromion without getting problematic situation. So in that way, they are going to work. And so now the clinical anatomy of all this structure. So there the patient can develop tendinitis or tears, okay, tear of individual muscle or tear of the whole rotator cuff can happen. Commonly it is happening in the supraspinatus muscle. Then even subacromial bursitis, which is again a very common condition where the inflammation of the subacromial bursa is happening because of repeated overhead activities are causing continuous friction of this bursa under the acromion process or coracoacromial arch, and that's why it gets inflamed. The patient will be having swelling in the bursa, and that can give rise to severe shoulder movement, severe painful shoulder movement. Later on, that can convert it into frozen shoulder also. That's why it is very important to have a early diagnosis and to treat it respectively. उसमें physiotherapy का बहुत ही अच्छे से रोल आता है. The another condition which can happen over here is supraspinatus tendinitis or supraspinatus tendon. Again, this happens with the overhead activities. If any person is doing more amount of overhead activities, this can happen. So that's why again, uske liye bhi you need to have a proper stretching, regular stretching and all. You need to have a proper posture so that you can prevent all these kind of problems. But अगर वो patient फिर भी बनते हैं इसके और they come up with the problem. So with the proper physiotherapy technique, we can deal with those conditions. And the last is rotator cuff tear. So any kind of sudden force traumatically, if it is coming on the rotator cuff, it can get tear, it can get damaged, और patient का वहाँ पे shoulder stability चली जाती है, and they are not able to perform the overhead activities. So all these kind of problems can happen. So here we come at the end of scapular region muscle. I hope you guys are not having any doubt. Still, if you have doubt, you can contact by message. Okay. Thank you.